Our guest today is Ms. Keisha Crenshaw Walker from Michigan 211, and I'm going to stop my share and turn it over to her.
Thank you, Tedra. Thanks to everyone for joining. I'm just going to briefly go over 211, just some information about our network and the services that we offer. And then I would like to end on with a demonstration on how to search our online database to find information about our network, and then how to find resources on our database. And I'll also give a demonstration on how to request to be added as a resource in our database. So Michigan 211 is a statewide network. And I just kind of told you briefly what we're going to go over about 211, a little background, just our service delivery and a relationship that we have with My Bridges and MDHHS for integrated service delivery. And then we'll have time for questions. So some of you may be familiar with 211, but for those of you who are not, just briefly, we offer a toll-free service, and we're accessed by dialing a short code, which is 211, and it's available throughout the United States. Right now, the United States has about um, just over 95% of the country is covered with 211 service, and all of the counties in Michigan have access to some sort of 211 service. And we have a trained community resource specialist, and they provide referrals for needs, and that's from everything from child care resources to education, employment assistance, or utility payment assistance. So we'll kind of talk a little bit more later about our top requested resources. Here in Michigan, we have a statewide network, which we collaborate with 7 regional contact centers. So I work for Michigan 211, which is kind of like the state office, and we help 7 regional contact centers. And those centers actually offer service to select counties in their region. That way, everyone is serviced by someone that is kind of in their region where they live. So the people that answer the calls, they actually live and work in the region that they service, as well as they have a relationship with the community. The resources that are in the database, they have a relationship directly locally with the community, as well as those that answer the calls. I mentioned our regional centers. They are accredited by the Alliance of Information and AIRS, which is the Alliance of Information and Referral Systems. And that makes sure that we follow best practices for managing the resources that are in the database and handling contacts. We currently handle over 400,000 contacts a year, and we provide over 1 million referrals for people in need. And this service is available 24 hours a day. It's available 7 days a week, and we have various methods that we can be reached, which is over the phone, via text, online chat, as well as searching for the resources yourself on our online database. So after this, I'm going to show you the map of our coverage throughout the state and our centers that cover it. But these are just the various access points. So dialing 211, texting your zip code to 898-211, which will connect you with your local 211 agency. And this all is available 24/7, 365. So this is a map, and it may be a little hard to see, but this just kind of shows our 7 centers and which counties each of them cover. And this is available on mi211.org if you want to kind of take a closer look and see which center represents your region of the state. So I mentioned our top referrals. These are the categories of assistance that are the most requested. And it's utility assistance. Right now, going into October and November, we'll have a lot of requests for assistance with utility, with electric bills, gas bills, home heating, fuel bills, and that sort of thing. Food resources, especially now during the pandemic, there has been a high demand for food resources, and we have quite a few food resources in our database. Then housing and shelter, employment assistance, childcare, education, and then healthcare and mental health services, as well as household needs. So these are the top requested items. When someone calls 211, What they can expect by phone is a trained agent will answer the call, and they will use their information and referral skills to do an assessment to see what the caller's needs are. While a caller may present with a primary need of food, we'd like to ask them a few more questions just to find if there are any underlying issues that exist that are causing the food insecurity that we may be able to address. So, if someone is, for example, they may be working an underpaid job or they don't have a job, and we find that out because they requested food, we're able to offer them resources to help them with finding a better job or access to more gainful employment. On the web, there's a search that I'm going to demonstrate where you can look by category and kind of find anything that you may be looking for. And you can do this any time of the day without actually speaking to anyone. And that's a service that's available to anyone just by going to our website. So I'll demonstrate that later. And then via text, as I mentioned, if you text your zip code to 898-211, you'll get the same service that you'll get over the phone. A live agent will respond to your text and they will provide you with resources based on your need and your location. With regards to our database, we have over 7,000 agencies in our database, over 14,000 sites with over 36,000 individual programs and services. And these are managed by certified database curators. And again, they're certified by the Alliance of Information and Referral Systems, so that means that they have the most accurate information and they're able to curate it in a uniform manner so that the records in the database are consistent. These database curators are locally in each community, which means that for the region that they represent, they all have a direct relationship with the contacts at the agencies that they manage. Michigan 211 and My Bridges, we're in a partnership with MDHHS to offer integrated service delivery through the My Bridges portal. So that means that a select um, assortment of our resources have been linked to My Bridges to help those that have a My Bridges account, where they're able to also, in addition to applying for things like SNAP benefits or any other MDHHS benefits, they can also look for supportive services from our database. This is just a look at the My Bridges portal, the new My Bridges once they log in. And there's a section that links to like subtopics and categories for what they've selected for basic needs from our database to go into My Bridges. Anyone can have a My Bridges account and you'll be able to log in and look for resources, even if you don't apply for any services from MDHHS. Um, they'll map out anything that you search for based on your address that they have in My Bridges. And again, you can save these records and they will be updated in real time because they're linked live to our database, which means that when a service is updated or changed and you've saved it to your My Bridges account, you'll be able to see the most current information as updated by our database curators. Now, My Bridges has a select number of categories of services that they think are relevant to their clients, which are the ones that show in My Bridges. But if you would like access to all of our resource categories, the best option is to either call us by dialing 211 or visit our website and take a look. So that's just an overview of our service. And again, we're working to serve citizens of Michigan just to make sure that they have access to the best, most up-to-date community resources. And I'm going to demonstrate how to search for those resources on our database and look for ones that may be relevant to those of you that are watching. But before I move on to our web search, are there any questions? So this is our website. And as I mentioned, we do work with 7 regional contact centers. But from mi211.org, you're able to enter your county and you will be taken to the resource database search page that is associated with the county that you entered. They're all connected internally. However, just the interface, if you'll notice, when I entered Ingham County, up here it says Central Michigan 211, because that is the center that serves that county. In order to search, just kind of enter your zip code and then it'll populate the city for you. And you can search from any number of categories. You can select our top 25 services, or you can select a category such as bill payment assistance, um, food, healthcare, transportation, and so forth. I'm going to just take a look at the food category.
Keisha, before you do that, up at the top where you put your zip code in, there was a space for your age and your gender.
Mhm.
How is that helpful?
So, the age and gender will it will include that information in the search. Um, there's a small percentage of resources, maybe if you're looking for a women's shelter or some things like that, that may be um, have a gender requirement, or that may be filtered by gender or age. Most of our resources are not, um, but that would be helpful to kind of filter that search. It may limit your search. So in the event that you put something in there and you don't get a lot of results back, it may limit depending on the category that you search. But it's not a requirement for the search, but it is a function of the software that we use for our website.
Okay, thank you.
Mhm. Clicking on the category of food, you'll see that it has emergency food, food programs, or meals. And if I take a look at emergency food, there are different searchable terms that fall under emergency food. The little question mark bubble here will give you if you hover over it, click it, it'll tell you, kind of give you a description of what that term means. It's our service definition. So for food pantry, it's a program that programs that acquire food products through donations, canned food drives, etc. They distribute it to people in need. And then food lines is a little bit different, where they have food boxes or bags, and first come, first serve for people who line up. But if you click on one of those terms, you'll be able to kind of search for results. And that's based on the zip code that I entered. So if you kind of take a look, you'll see that it gives me a list of food lines, because it's the one that I selected, that serve the zip code 48912. Over to the right, there are some links where you can print the page, you can save it, you can email a link to these search results, or you can click this to start your search over. If you click Map All, a map will appear and it'll map the results that are on the page. And you can zoom in on that map just to kind of see where they are in relationship to the zip code that you entered. You can click View More Info for any of these, and it will tell you the eligibility, the application process. This is the standard format for all of the services that are in our database. So you'll see the fees, payment methods if applicable, who they service, their service hours, the site hours, any accessibility information will be there, along with their address, phone number. And again, you can email or text this by clicking this link, or you can print it. And if this is part of a larger agency and this is just one location, you can click Parent Agency to view the parent agency's record. If you look down here, you'll see that this Allen Neighborhood Center has some other services and programs at this site other than this food line. They have farmers market, restaurants, food and leisure activities, recreation, general state and local health insurance information and counseling. So any agency that has additional services, you'll be able to kind of see it right there. I'm going to start over with the search because down here there's also a service keyword where if you wanted to use the keyword search rather than clicking the category, you can start typing a keyword into the box, and it'll kind of populate some choices here for you. So, and you can select what you think it is that you're looking for when you see it and click search. And then it'll give you some resources. And again, that's based on the zip code that you've entered. If you want to change that, you can change it here on this page, or when you start over, you can change it at the top. So I just searched here for independent living skills instruction, and it gave me 4 matching resources. Here's community-based interventions. Again, it has the eligibility, the service description, how to access the service, and the other programs that are offered at that location. Before I start over with another search, are there any questions?
Not at this time.
Okay. So you can also search by the name of an agency or program. And the same as with the keyword, once you start typing, it'll start to give you some information that may match what you're typing, and in which case you can select the one that you're looking for. And this is what it will look like if you search for the agency. Rather than bringing up the individual service like we did before with the service search, it brought up the agency that I selected, and then it just gave a list of each of their programs that they have there. Life care planning, protection and advocacy for individuals with developmental disabilities, school systems advocacy for individuals with developmental disabilities. And they also offer a specialized information and referral for developmental disability issues. And 211, we're comprehensive information and referral. So we serve the state of Michigan geographically. And so we have like a broad range of information. A specialized information and referral will have more in-depth information and services for target populations. You can click on any of these for more details, and you'll be able to see again the eligibility, the contact methods. This one has a fee here. Some of their other programs, you can take a look and see what they offer. So is there anything in particular that anyone would like to look up before I go on to showing you how to get your agency listed?
I don't, not in particular about being, there's nothing specific to be looked up, but my question are there any, like here, if you were a person with a disability and I just wanted disability services,
Mm-hmm.
I see that there's not a icon for that.
Right.
So is
So
disability one of the,
we have the target populations. And right now, because we just went back to this software vendor, our categories have not been fully updated. So when you go to the target populations and you click on individuals with disabilities, we do have a few terms in here, but before the end of the year, we're going to continue updating this so that there is more robust terms in here. because right now we just have these 4 that are listed. However, if you go to the service keyword and kind of, oops, start typing, and I just started typing the word disability, you can see some of the terms that are actually exist in our database that may be relevant. And what we want to do is to work on our target population category to make sure that the ones that have that are most relevant to the target populations are listed so that they're readily available. But as you can see, there's so many terms that we have in here.
Mm-hmm.
That may be of value to persons with disabilities.
Can we see what the disability rights groups are? Can you go to that?
Mm-hmm. So these are the ones that come up. And mind you that I'm searching with 48912, so I'm getting things that will either serve the entire state or just serve persons that live in that particular zip code. So if there's something that you don't see, but they may serve, they may not serve that zip code.
Okay. So when you put in, if you're a statewide organization,
Mhm.
and when I guess you'll show us that when you show us how people can register their organization.
Mhm.
Okay.
Yeah. And so from here, you can just kind of click view more info as we did before to see exactly what services are being offered and how to access the services.
Okay. Thank you.
Mhm. Going back to the mi211.org homepage, if you click on the menu and you select providers, there is a add or edit agency request. Again, well, let me choose a different county just to show you that it'll take you to the page for the southeastern Michigan because I
Mm-hmm.
selected Oakland County, but all the pages will look the same. And just to pop back to the general search page, there's also a button at the very bottom that says for service provider tools, which gets you to that service providers page. So there's multiple ways to get there. But once you're there, there's a button that says get listed. So if you are a service provider and you're interested in being included in the database, this one, I'm back on the page for Central Michigan 211, so it says that. This one is for the United Way for Southeast Michigan because I selected Oakland County for this page. But again, the form is going to be the same. And if you end up, and the form actually is submitted based on the information that you enter here. So if it finds out that, let's say I entered this on the Southeast Michigan page, but I really serve Muskegon County or I serve the entire state, the information will be directed accordingly to the proper database curators. So what you would do is enter your organization's information, the email address, website, kind of a brief description of the programs, your name, and you submit that. And then it's sent to a database curator inbox, at which point you'll be contacted for more information. And they'll actually gather the information that's needed for the service. So while I mentioned that we have regional centers that manage the records for the local resources. If there are some statewide resources, we do have people at the Michigan 211 state office. We have curators that manage those statewide resources. So it would be up to the agency to let us know what the service area is for their program.
Keisha, we have one participant asking if they can receive some of this information through an email.
Okay. So everything that I've gone over, I did provide to Tedra as far as the slides, as well as the instructions for going online and accessing the tools. And if that's what they want, I'm sure that they could be provided that. If there's something else, you can let me know and I can try and assist them with that.
Yes, Mary, the slides as well as the info about going online, as well as the recording, will all be posted on the website.
Thank you.
So I'm going to just go back a bit. That's how you can request to be added. If your agency's already in there, you may already have a password where you can log in to request changes be made to your or updates be made to your record, and the agency contact will actually get an annual request from us for an update to make sure their information is all correct and nothing has changed. And they can also at any time log in to request updates or make changes to their information. If the agency is already listed and they do not have a password, or maybe the person who had it is no longer there and they didn't pass along that information, you can also go in here and fill out the request, and you will be contacted by the database curator that manages the record for that agency.
Do all organizations, is everyone accepted that completes the form?
Well, we do have guidelines for inclusion and exclusion. So they would have to fit the inclusion exclusion policy. Well, to be included, they'd have to fit within those guidelines. So that is once the database curator gathers the information. Once they gather the information from you, they will actually compare that to the policy, and then they will let you know. As you notice, we try and have things in our database that are very low cost to no cost. So you won't find a lot of for-profit businesses that are in our database unless they are offering a service that is on a sliding scale or that is of great value to the community, that is not at a high cost. So there are some guidelines that have to be met.
Okay, thank you.
I do have a quick question, Keisha. In the beginning part of your presentation, you talked about where they could determine whether a place was accessible. How is that done? Is that simply up to the organization and how they answer a particular question on a form? Or do you have some format or parameters that determine whether a place is accessible or not?
Yeah, so it is provided by the information, by the agency itself. We do not verify the accessibility. We kind of take it at their face value. However, if in the event that you go somewhere and something is misrepresented, and we do sometimes get things may have changed and not particularly related to accessibility, but maybe a business has moved or a phone number has changed or they no longer offer a service, we'll get feedback like that from the community, and we'll contact the agencies to make sure that we have the most current and up-to-date information. But all of that information is provided by the agency itself.
Okay, thank you.
Mhm.
I guess to follow up on Mary's question, if you got feedback from the community that an agency wasn't accessible after they, had said that they were, would you take it down?
Yep. So if we are unable to verify, and again, once part of the inclusion exclusion, we do have to verify that these agencies are in good standing with the state or the government, that they are legitimate agencies. So we do kind of go through that vetting process. But if there is something that is misrepresented, we will deactivate the records until we're able to verify the correct information. So we would not leave something that is incorrect or invalid as an active item in our database, which is why it's helpful to have a curator assigned to each record so that they have some sort of responsibility for maintaining the accuracy of the information.
Okay, great, great. Let's go to Tracy and see if there's any questions or comments on the Facebook Live.
There are no questions or comments at this time.
None in the Q&A at this time.
Well, geez.
Well, that went rather smoothly. I don't necessarily have anything else that I planned to present, but if you have any other questions or anything else you'd like me to go over, I'm certainly more than happy to do that.
How did you all get your target audiences? Like the breakdown for the target audiences, you said that you wanted to work on adding more and have a more robust.
Well, within our database, we have, and it's hard for me to kind of show from the outside because the website is not doesn't have the targets on there, but we have things that are indexed. Like if I type in youth, you can see that I have like resources here for that target population, adolescent youth. So we do have them in our database. We have let's see, we have like LGBTQ resources in there that are targeted. We have children's issues. So it's just a matter of updating our website to reflect a list of target populations that is more representative of the breadth of targets that are in our database. And right now, like I said, we've just migrated to this software platform, and our website is going through some transition right now. So we have not added all of the targets that exist in our database to the web search.
That expansion will be great. It'll really help people.
Keisha, a question. Do you have information on your site about accessible voting or anything to do with voting?
So what we have is we have information on polling places, absentee ballot information, and we also have information on election day. There are some resources that provide rides to the polls.
Okay, thank you.
Mm-hmm. And again, that's dependent upon what's available in your area. So some counties may have more programs than others.
Well, great. Thank you, Keisha. This will be the last call. We'll do another call for questions. It was really straightforward and really more intuitive than even I thought that it was. Seeing no more questions for you, ma'am.
Thanks for having me.
Thank you so much for joining us today. We really appreciate it. And that was some really great information. One of the things that we found that people need the most during this time is information. And so I would like to extend our thank you again to Keisha for joining us this morning. As always, the recording should be up by next Monday or Tuesday at the latest. And please join us next week where we will have 3 guests joining us to talk about using YouTube as a venue to make your voice heard and to combat some of the isolation that's going on. in regards to, or due to the pandemic, and really just how people with disabilities can use YouTube and help get your voice heard and your message out. We will see everyone back here next week at 11. Again, thanks to Keisha and thanks to everyone that joined us today. Have a great day. Bye.